Change the setting at all to do it in there? Okay.
It does automatically
Okay.
rotate.
All right, let me know when we've started, Jen.
I'm ready, yep.
Okay. Hello, everyone. Deep Frontline course. Here I am in Upper Magna, UK, doing my DFL with these lovely humans. And I'm going to now demonstrate what I'm going to talk about femoral joint centration. So that's where we're going. So like before, we're doing our assessment, and my lovely model, Joanne, has consented to being filmed. And Joanne has mentioned that she's had an existing sort of long-term problem in this side of the hip, usually SIJ. But as we lifted this leg through assessment, and I'll do that in a moment, we could feel just the congestion here, and there's even some heat here. So as we palpate, it just doesn't feel, it feels sort of fascially dense. And that gets your, that could be, and then you'll feel the tension off the hip flexors, the tendon of the psoas and iliacus. You can feel it, you can kind of feel that, and it's holding. So one of the areas that we work in the deep front line is this site of caution, they call it endangerment. And the reason is you have a neurovascular bundle coming through, and of course, the area, it's adjacent to the pubis and genital area. So when we palpate, we always want consent, and we want to do it sensitively. That said, as I feel that hip flexor, and the lens being the abdomen and the psoas with Joanne, that's the quality of movement I have here, and I'm always looking for that level of first restriction. So as I push down, that right side's just a little more dense, wouldn't you say that, both viscerally and hip-wise? Mm-hmm. Now as we come down, we work through, yesterday we taught that you can do a variety of assessments. What I showed to start with was that when we pull the pillow out, was to just do the basic things like rolling the limb. Now when you roll the limb, that gives you joint and surface information. It gives you a quality of how the movement is and how it sort of, is it restricting or ratcheting in a sense? Is there stopping as you move? It shows guarding, like we had guarding, with you, Hannah. So as I pick this up and I sort of stair-step my way up, I do a little leverage compression. We did this in polyvagal. And you can see how the head moves or doesn't move. And as you're using a lever, you can feel the areas as it comes through. So if this lever was really clean, if the surface was really open, if the hip was in the fullest range with no density, you'd see so much more movement. And you can almost isolate each link. This side, you feel how that's got freer movement. And this is more your chronic. Boom, it stops you. Right where you said, even a little sooner than the SIJ, like we've got the glutes to play with. So when I flip you over on your side, I'll play with it. The problem with an airbed is when there's no face cradle, you more have to do side, because I don't want you having your face planted or holding your arms up. Okay, so if I was to then, so that's part of it. Now, what I didn't talk about yesterday, and you saw in that video, is tapping. So what we're doing, and you can feel the density of the bone on this side correlates to the density of the tissue. When you tap a bone, you should have a certain vibration that you feel. The cleaner it is, how do I describe it? It's as if it's less dense and it's more relaxed. And so and I use tuning forks on these as well to vibrate when I can't seem to get what I want done. Now you're very tight behind the knee, and that's going to be one we'll have to clear. Now whether I do it, I taught that yesterday prone, but because of the way we're sitting, I'm going to work it supine and side lying. That'll give you more variation to play with, okay? Because you can work any direction. So see how, Ben, do that torsion on that side, and you feel how that goes? Now reach across and do the torsion on this side. You guys want to round robin in on this and just feel that? So what we've been doing in this course, as we're videoing, is I've because I have the luxury of a small course, we get to really augment assessment. So everyone comes up and does it, and then I clear it, and you feel the difference. That's sort of, you can feel the difference?
Yeah.
And that's what you're looking for. That's what you want to assess. Beautiful. Real quality differences there. Yeah. So I'm gonna clear that for you, okay? If I can.
Yeah, that'd be great.
Yeah. And that leg will feel really different. Yeah, isn't it? Yeah. Very clear. It's all there. Okay. Now, now there are a couple ways to do this now. Now, I was showing yesterday that we could work the sleeve, so let's put this under. Okay. When you're working a sleeve, according to what we were showing with a little roadmap of Paletti, you have fiber directions that spiral around in that helical spiral way. You have vertical, you have horizontal fibers. So this tissue loves to be engaged. The other thing I said on the quads and on this epimyosial tissue is you're asking it, does it want to be lifted or does it want to be pressed? So when we engage that tissue, it sort of starts with a grasp. See, I could do that, but you notice I'm combining. I'm sort of gathering, holding, and that always feels much better. We also showed some really specific moves like the pes and serine. So I could do a full sleeve one. We can start like that. And what I would do would be I'd gather that tissue and then anchor on it and wait. And that was the fundamentals that, you know, are foundational. And there you go. You can already feel it sort of respond. And that was quite quick. And that changed the density down low. Okay? How much more?
I could actually feel it in
And you
my
can feel
lumbar.
it up there. So we're going to keep playing with it. Now, I showed a little. So when you're after doing this pes and serine high leverage point, what happens is these three tendons merge together on this medial aspect of the tibia, and the fibers they're supposed to be sort of rolly, but they flatten out and the connective tissue just glues it. So if you think with your intent, you're trying to not dig it out with a friction, but you can grasp it and pull it out. Does that make sense? So that's what that was. And so as we grab it, we hold it, we check our ease bind, it goes up, you roll in, and I might just do movement like that. You feel me trying to pull it away from the bone, and there it goes. It just pretty much gives. And then we wait, and there you go. In a moment, you'll have your nervous system response kick through. And you must factor in the pacing and the spacing. And we call this periodic disengagement. This group is all Bowen practitioners plus Bowen plus. That means they understand how to give space between technique. They're taught and embedded this work, so that's what you guys know. As we move on now, you can see what I did with that. Everything affects the line. Both are nice, but you can feel that's changing now. Now, yesterday we did aptly squish where you were face down. We put this in 90 degrees. We put compression, torsion, and a pump. What version of that can I do here? Well, it's much harder, isn't it? What I would have to do would be some sort of, now let it slide, and something like that. Now, if there's pain in that, you wouldn't do it, right? There'd be damage to the meniscus or the ligaments. But if there's no pain, yeah, you can feel that one. It got a little bit of the knee capsule in it. Come back again, and oh my goodness, the tissue's moving now. Boom, look at what it's done to the ankle. That's why your knee compressions work the meniscus and ligament, and they get overlooked. Cannot tell you. Ligaments are overlooked in treatment, and they are dynamic. Jeff Vanderwall talks about dynamins. We talk about that in foundation course, the dynamic interplay between ligaments and fascia, ligaments and muscle. You feel how you're getting an effect off that still coming up. Can you?
I could feel my, I felt don't know, like a heat come up.
Great.
And I felt digestive
Good.
moving as well.
So you see that interface of the line showing what we're doing on the line affecting what we're trying to do with psoas and viscera. Now I come up and it's softer than it was. So this is the thing that's really interesting. Your benchmarking doesn't mean you have to treat that right away as a muscle. You can benchmark its tension, and then you see what the joint, ligament, and fascial relationships. That feels much better, and you can handle it now. Now it's still tender. It'll be tender if I press really hard on it, but it's there. So I've got my finger under there. I'll hold it, and I'll just do a reverse pump like that. Put it down. Now, when we come around, this is looser than that one, than it was. We got greater motion at the ankle than we have here, and that sets me back up now for joint centration. I wanted to show you, which I didn't show you yesterday, is you can also do the periosteal tissue on this tissue here. So if you guys want to come around, this is a good time for periosteal tissue. Periosteal tissue, you don't have to go really deep with. It should feel sort of nice to get it moved, does it? And now you're really thick down here, and it's heat here. So now I have a decision. When I feel something like this, I go still for a moment. And I do that you can see how little movement is there on the tissue? Now I've got a choice point. You know, what do I want to do here? What can I get done? So when in doubt, hang out. I'm going to put a little fulcrum. See how I'm sort of playing that fingertip fulcrum? I'm going to wait there. Now, when you touch bone, it's not just about the bone, physical bone, and the periosteal tissue that nourishes the bone. It's about bone energy. And anyone that was taught in zero balancing will know that. It's about, there you go. Can you, yeah. And see, watch Joanne. She's resting. There's something going on here. I'm going to shift it down. Now, might be a little tender, but I'm on it. Again, I'm checking it. Now, this, I teach this in my biofields energy course, is the bone energy, but it's kind of cool because this is physical tissue. Here we go. We've got a change coming through. This is like, what? I don't know, watching bread rise. This is sort of like watching paint dry. You know, for the folks on the film here, you gotta believe that I'm telling you this isn't all smoke and mirrors, folks. Because it is sort of funny. You sit here and it's like, what's going on? Nothing's going on, you know. And the fact, no, that's not true at all, but you can't see it. You have to feel it. Here we go. Now, you can see that now as I move that tissue. There it goes. I can move it. It's probably a little less painful to do that. I'll start to move the joint, move the tissue, roll the limb, and, feel that now. Feel what that's done after that.
It's a lot freer. Wow.
Feel the joint moves?
Yeah.
Come around and feel that, and then we'll finish the filming with the hip at this part. Now this is this is sort of crazy. Feel the difference? That's what's normal. Okay? That's what it should be. The problem in a lot of things is we don't know how much release the body's capable of giving and what is a more normalized movement than what we have here. Isn't that wild? There's so much movement to it. Now we come, and that has changed this. So I don't know which often is the horse or cart. I just know they're connected, and one leads to the other leads back. Now, if I was to pull this out, lift it off, now what's tight? So the last piece is the demonstration why we're even doing the video. Is to come up, place your hand around the trochanter. Let this come outward in abduction. And this was for you, Jules, yesterday. That was the piece I wanted you to get. You had the up part, you didn't, this is the more crucial piece, by the way. And there you go, she's letting me slot. See how she wants to slot? There's the natural slot point for it. So what you're doing is your anterior and then inferior, the knee needs to be abducted. You're at 90, or no, you're at 45, and then you're coming out what, about 30? There it is. You feel how it just sort of settled in, and then you let it drop. And we wait. And that should be enough on the filming. Thank you, Jan.